Cholera Outbreak, Bayelsa Faults NCDC'S Surveillance Report by Samuel Oyedonga, Yenagoa. Bayelsa state government, through its Ministry of Health, has faulted the inclusion of Bayelsa on the list of states affected by cholera epidemic outbreak as recently published by the Nigerian Center for Disease Control, NCDC, in its Disease Surveillance Report. The Permanent Secretary of the Ministry, Dr. Toyin Azebi, refuted the report at a joint press briefing shortly after a meeting of the Bayelsa Taskforce on Immunization and Health Services presided over by its chairman and deputy governor of the state, Senator Lawrence Ewhrudjakpo, in Yenagoa. Recall that the Nigerian Center for Disease Control had in its recent Epidemiological Week 22, 2024 report placed Bayelsa as amongst the states with the highest burden of cholera cases. Dr. Azebi, who pointed out that there was no confirmed outbreak of cholera in the state in recent times, noted that the NCDC's pronouncement of cholera outbreak in Bayelsa was a total misrepresentation and should be discountenanced as such. She emphasized that all suspected 449 cases of cholera in the state from January to date had turned out negative from clinical laboratory tests, as they were proven to be cases of gastrointestinal diarrhea. According to the permanent secretary, the ministry had reached out to the NCDC on the issue, and they had reviewed the state data again and found out that their initial report was incorrect and agreed to issue a rebuttal, which they had not done as at the time of the press briefing. She said, "The NCDC report is a gross misrepresentation of the Bayelsa data, and we have tackled them on it. They have reviewed our data with us, and will soon do another pronouncement excluding us as a state with a cholera outbreak." Since January 2024, there have been 449 suspected cases of cholera reported across the 8 LGAs. Importantly, only 2 new suspected cases were reported in the most recent week, indicating no new cases. We are able to even report these cases of watery diarrhea because of our optimized surveillance system across the state. Related news. France reports nearly 200 cholera cases in Mayotte. 1 dies, 5 hospitalized as cholera outbreak hits Ogun. Nigerian newspapers. Death toll rises as Lagos records more cholera cases. Extensive testing has been conducted to confirm cholera cases. Out of 42 rapid diagnostic tests, RDTs, carried out, only 14 returned positive. Crucially, all 14 positives from the rapid diagnostic tests turned out negative when subjected to culture test. Culture tests are the gold standard for cholera diagnosis, and no cases have been confirmed by this method. And this attests to no outbreak. In summary, the cholera situation in Bayelsa State is under control with no culture confirmed positive. The state government is taking active and comprehensive steps to manage the situation effectively, ensuring public health and safety. Commenting on the issue of a dead whale found on the shores of coastal Okpuama community in Brass local government area of the state, reportedly being butchered for food, Dr. Azebi cautioned the people to refrain from the act as it could lead to a serious epidemic outbreak. According to her, consuming the dead whale could lead to mercury poisoning, botulism, and bacteria infections that might prove dangerous to the health of the people. Also speaking, the Director of Public Health, Bayelsa State Ministry of Health, Dr. Jones Stowe, said the state's disease surveillance system was well fortified, noting that all suspected cases of cholera were negative to culture test. On the few reported cases of yellow fever across the 8 LGAs in the state, Dr. Stowe informed that the ministry was taking proactive steps to ensure no deaths and no further spread of the infection. According to him, presumptive positive cases are being monitored closely while the confirmation tests are awaited from Dakar in Senegal. The number of confirmed coronavirus, COVID-19, cases in Africa has reached 4,330,666 as of Saturday, the Africa Centers for Disease Control and Prevention, Africa CDC, said. The Africa CDC, the specialized healthcare agency of the African Union, AU, said the death toll from the pandemic stood at 115,191, while 3,888,495 patients across the continent have recovered from the disease. South Africa, Morocco, Tunisia, Ethiopia, and Egypt are among the African countries with the most cases in the continent, according to the Africa CDC. South Africa has recorded 1,556,242 COVID-19 cases, the most among African countries, followed by Morocco at 500,984 cases, and Tunisia at 268,837 cases. It was noted. Xinhua/NEN says reports a complete misrepresentation of state data.
Thanks for being there. Earlier on the news, we told you that Nigeria has reported 65 confirmed cholera cases and 30 deaths across 96 local governments in 30 states from January 1 to June 11. We also told you that about 60 people have been hospitalized in Lagos with about 4 deaths recorded. We have joining us on the news to discuss this Dr. Chukwuka Pascal Obodo, CEO and co-founder My Medicare. Dr. Obodo, finally, we're able to have you join us on the news. Thank you.
Thank you very much.
So we're actually looking at the numbers, 65 confirmed cases of cholera outbreak in the country between January 1 and June 11, with about almost half of that people died. 30 people actually died. Now, I was actually asking in terms of the reactionary time to these cases and the kind of treatment being preferred, would you say that the services or the service has been optimal, or do you think more could have been done to save those lives?
Okay, thank you very much for that. All right, so for me, obviously the numbers are very, very bad. Okay, quite a number of individuals, when we're talking about human beings, okay, that died because probably they didn't get what they needed to, the treatment that they needed to get. All right, and proper follow-up. Okay, so it's not a figure that we need to be proud of, and I really believe that a lot can be done to keep that moving forward.
So what measures now can individuals and communities take to prevent the spread of cholera, especially during this rainy season?
Okay, so I'll have to break it down to individuals, communities, and of course environmental. Okay, for individuals, okay, personal hygiene is very important. Washing of hands, cleaning your toilets. Okay, ensuring that the water you take, if you are not sure the source, you can boil the water for decades. Okay. For the community, at the community level, health education, because many people don't even know how cholera is transmitted. Okay, so a lot can be done about that, just like we are doing now. Telling people more about cholera, teaching them to understand, how it's being transmitted. In addition to that, safe treatment of water, okay, making sure that water is properly treated at the plant before being disposed to individuals that will consume that. And at the environmental level, ensuring that we don't throw in dirt, okay, or waste products into our waters or water, because at the end of the day, it might still find its way into the water supply that most individuals have access to.
All right, now we know that Lagos has a population of about 20 million. Now, given the recent outbreak in the state, what steps would you expect health authorities to take in order to manage and contain the spread of the disease, most especially in a country that is heavily trafficked by people?
Okay, so about that, number one on the list is still people. Okay, vaccination campaigns can also be done because there's a vaccine that can be given to more or less enhance people's immunity to cholera. In addition to that, having protocol team, okay, I think that should be the best thing to be done. Okay, this protocol team, what they will have to do is identify those that have cholera, isolate them, properly treat them. Okay, treatment has to do with rehydration, giving of antibiotics, to those individuals that are already affected. More so, I also talked about the vaccine. Very, very important that they do that because that can help, curtail that. And I believe in that a lot of lives can be saved.
Let's speak more about what an individual can do, most especially in suspecting such a case. If I am to actually find out or notice that someone has the strains or symptoms rather of cholera, what are the physical signs that I should be looking out for?
Okay, what is true? Okay, this is those that have cholera, they find it very hard to control their stool. Okay, their passwords is stool from like continuously. Addition to that, some individuals vomit. Okay, when it gets very bad, because certain electrolytes are being lost, there could be cramps. Okay, muscle cramps, other form of objections. So these are the signs. Okay, that these individuals have. So moving to that, when you have, when you're feeling very badly, and you dress a lot, ensure that you hydrate yourself properly and report to the nearest hospital so that you can receive appropriate treatment.
All right, Dr. Chukwuka Pascal Obodo, CEO and co-founder My Medical. Thank you so much for educating us this afternoon.
All right, bye.
Thanks for tuning in to Smart Okason TV show. Keep exploring, stay curious, and never stop getting the latest information happening around. Don't forget to like, comment, subscribe, and share to keep the intellect flowing. Until next time, keep sharpening and be smart.